Hello, beautiful people, and thanks so much for watching us here on Great Day Louisiana. I'm Malik Mingo, as always. I hope you're doing well today. And look, we have a great show for you all. We're beginning in our LCMC Health Wellness Lounge because, listen, it is back to school season. Is getting your children vaccinated a part of that to-do list? If so, we are talking about why it's important to get immunized and what vaccinations your child should be getting. Joining me now for a conversation is Dr. Kenneth Cruse. He's a pediatrician with Manning Family Children. Welcome to the show.
Well, thank you for having me. I'm excited to be here.
I'm excited to have you on as well because look, when I was going back to school, I loved going to the doctor because it was time for a checkup, it was time to get vaccinations, and we're talking about that today. I want to start at the core, right? What is the purpose of a vaccination? Because I feel like there's some misinformation out there. Some people think, oh, you're giving me the virus so I can develop antibodies. No, it's deactivated. Let's talk about that.
Sure. I mean, and you bring up a couple of things. There are certain different types of vaccines, some that are deactivated, some that are activated. But what they aim to do is to allow the body to create antibodies for a particular illness so that when someone is exposed to it, they will have the immunity to fight them off.
So that's why it's so important to get vaccinated, because say I get vaccinated, which I am, right, for maybe COVID or the flu, then I come in contact with somebody who maybe is not vaccinated, who does have flu or COVID, the vaccine's supposed to help fight that off.
Correct. And now some of the viruses mutate so much. I think we all know that after COVID came through and all the mutations. So when they mutate, some of the viral vaccines that we get yearly are not 100%, but they can give you some immunity. So if you do catch it, it's going to be a milder case.
That's why it's important to get them yearly if your doctor suggests getting them yearly, because again, they mutate all the time. When parents are going to their pediatrician, for example, to get their children immunized, what are some of the common vaccines they get?
We have up to 14, almost 14 illnesses that we vaccinate for across the entire spectrum of life. The common ones are the diphtheria, tetanus, and pertussis that have been around since I was a young 4-year-old.
So just a couple of years ago.
Yeah, not long ago at all.
Not long ago.
And then we also have polio, measles, mumps, rubella, COVID and flu, chickenpox. And I'm probably missing a few.
Because there are 14,
there's quite a few that we're able to prevent, which we don't see those diseases as much because our vaccines have helped. But sometimes that lures a sense of confidence that, that are they really working? Well, yes, they are, because I remember days we had those illnesses.
Absolutely. And there are some vaccine skeptics out there, people who maybe do not choose to get their children vaccinated. They have their own reasons why, but people need to understand that our vaccinations are tested for safety and effectiveness?
Yes. Our vaccine system has a tremendous history here in the United States of both safety and effectiveness, and it has evolved over probably 50, 60 years. The interesting thing is once we do become successful in something, we kind of forget about those illnesses.
Right.
And that's where sometimes people who may not understand the scientific method and how vaccines work maybe be lured into confidence that they don't need a vaccine. So I talk a lot to patients about that to try and say, look, this is why we're doing it, and this is why we're protecting your children at this particular age for whatever illness might be prominent.
It's so important that, like you mentioned earlier, 14 vaccinations are common for children to get. Is it something that they need to get every year, or does some vaccinations you can only get 10 years from now, or at 10, then 20, then 30?
And there is a wide variation in the scheduling of vaccines. The yearly vaccines include things like flu, COVID, and now even RSV for the elderly.
Should that be every year?
Well, to begin, and for the babies, they get RSV. Elderly and babies are now cleared for that. But a lot of the vaccines have a schedule of a certain number of doses. You get a dose which primes your body, and then you get a second dose that boosts it. And some of these vaccines have different schedules where they need maybe 3 doses to get the full immunity. And that's based on studies that show how much immunity you have after each particular dose.
So it just depends on the vaccine.
Depends on the vaccine.
It's important to talk to your pediatrician.
And your pediatrician or medical provider who's providing you the vaccines can easily tell you how that vaccine schedule works.
Now, say we go and we get our children vaccinated. Unfortunately, there are going to be some side effects. With most medications, there are going to be side effects. Of course, a lot of people know about the soreness where the shot is given. The two I didn't know about, fussiness and low-grade fever. Tell me about that.
Well, there's a history to that. I've done this long enough to remember when we would give vaccines years ago we would get so many phone calls a day or two later of children with higher fevers, 102 and higher, which is pretty alarming for a young infant. And usually we could decipher through, was it an illness or was it the vaccine? At that particular time, the pertussis vaccine was a different type of pertussis vaccine that created that common response. That was changed many years ago to a different type, and our phone calls went away. And so that type of side effect, we were able to identify what the cause was, improve the vaccine, and so now the least we get is maybe a low-grade temperature, not much at all, barely does that happen. Now, fussiness can occur because, let's face it, you get 2 or 3 shots at a time, and it hurts.
It does. It can.
Children always ask me, does it hurt? I don't lie. It hurts.
It will, but it's effective.
But it doesn't hurt very long. And the majority of children will get their vaccine, cry immediately, or depending on their drama, might go a little longer, and then do fine. But sometimes they can have fussiness, and we do recommend having some Tylenol available if they seem excessively fussy, that they can, help them. But we don't expect that to go beyond the 24-hour period.
Because at the end of the day, the goal of a vaccine is to be a barrier so that, one, you cannot infect others, and of course not get some of those diseases which are on the rise right now. Measles, chicken pox, pertussis.
Yes, and measles and pertussis are particularly concerning. We just about eradicated measles in the country when we maintain our immunization rate at 94%.
Wow.
And we're toying with that right now with some of the media that's out there that's questioning vaccines and not giving the full explanation. So it is really important to keep that level up so that we can stop the outbreaks we've seen. And pertussis is another thing because it puts our most defenseless children at risk. Babies that cannot receive the pertussis vaccine until 2 months of age. And pertussis is a very aggressive respiratory illness that can stop their breathing, can cause death or brain damage if not treated correctly. It starts as a cough and can get a lot worse. So those babies in that first 2 months need to be protected. If we have our older children and adults who are not immunized, they have the chance of spreading it to that most vulnerable population.
And we do not want that at all.
No.
Look, at the end of the day, we want to make sure our kids are safe. Make sure you check with your local pediatrician for all of these tips. Look, thank you so much for joining us today. And not only is he a pediatrician, he's a doctor, and he's also an author as well. His book, Stupid Carrot MD, is available now, Parenting Children to Independence. Make sure you check that out. And for more information about everything going on at Manning Children's, log on to the website on your screen, manningchildrens.org.